Hello and welcome back. We are continuing our series of interviews with our board members today with Jim Wilsey. So we will get started. Our first question for you, Jim, can you just tell us a little bit about yourself and what you do?
Sure. I am the chaplain at Roger Williams Medical Center. I've been there for 30 years now and was hired to work with people with cancer and their loved ones, and been doing that the whole time. It's been a blessing for me to be able to be with people and help them use their spiritual resources to cope with this disease, cancer, and to fight through it and endure the treatments that need to be done and to keep going. So it's wonderful to watch people and their resilience as they're diagnosed with cancer and then given ways to deal with it. Been, as I say, in Rhode Island with my wife Rose for 30 years as well. I came here for that position at the hospital. And over the course of time, I've been involved in many different aspects of cancer care, running support groups for men with prostate cancer, for general cancer support, for with the Leukemia and Lymphoma Society in Rhode Island Hospital. We do a group for people with blood cancers, so support groups have been important. Been involved now in palliative care, which is I came on board maybe 4 or 5 years ago as a very important aspect of helping people with more resources deal with this terrible disease.
So you do a lot with your work, obviously. Why do you find your work so rewarding, and what is the most rewarding with your work?
I think that the thing that I enjoy the most is listening to people tell their stories, and then as they tell their stories, come up with ways that they are going to deal with their cancers, and to watch the positive attitudes that emerge and the fight that they're willing to fight. So the whole human resilience, it comes up time and time again as people deal with whatever cancer they're facing.
Mm-hmm.
Jim, if I could ask a question, with regard to resiliency, is there one or two things you can point to that is sort of one of those areas that you say if people can think in this particular way, whether it's an attitude or whether it's an activity that really helps that the rebound, I guess, to the treatment?
I think one of the things that comes up, and I'm the chaplain, so I would be remiss as a chaplain if I didn't speak about dependence on God. So when people face something that they have a sense that they've lost control of, they can turn to a higher power. They can turn to something that they turn things over and let control their disease. Other people will point to their past histories or to their families or to a belief in the goodness in nature, and take those weapons, if you will, with them as they fight their disease.
It's really powerful. Thank you. So you've been involved with the partnership for a long time now. So could you tell us a little bit about your relationship with the partnership, your role over the years, and kind of the work that you've been doing with the partnership? What has that involved?
Over the course of the years, the Center for Disease Control had many projects that they tried to do to get a better control on cancer. And so when I began, there was a program called the Governor's Initiative to get the mayors of all the cities to have a cancer council, or task force. And I was part of the Cumberland task force in the early days. That evolved into the Partnership to Reduce Cancer in Rhode Island. And when that happened, I came on board hoping that we could do even more than we had done in Cumberland for people with cancer. So I've been involved with the partnership since its inception, and some of the things that really have been of interest to me were survivorship, and then especially the Cancer Summit, where we brought together patients and treatment officials and other caregivers and family members, and had wonderful speakers talk to them about different aspects of cancer. And often they would be able to talk about cutting edge technologies, a hope for the future, what 10 years ago when they started talking about biologics to the general public and to cancer caregivers, it was seemed brand new and out of the blue, and now we accept it as something that is an everyday occurrence, that if we have a way to treat this cancer, we can use a biologic on it. So.
Great. So you're our current chair of the board of directors. So could you talk a little bit about your experience in that role and any challenges that come along with it?
My experience in the role of chair is as long as I sit back and let the committees do their job, everything works wonderfully. I often say if I step out of the room for a minute, more gets done than when I'm there. And I say that facetiously.
That's not true.
I say that facetiously, but we have some wonderful people working in the partnership, and my primary role is facilitate discussion and to facilitate work groups to be able to do the job that they can do so well. So, one of the things that we're hoping to do is be able to get more people involved in the partnership. And I think if you saw the good works that were done, I can remember just a few years ago when I was chair of the survivorship work group, we've got a couple of people involved and did pamphlets, one on nutrition and what to do about diet during cancer treatment, and another one on clinical trials. And those pamphlets are available today to help people to become aware that clinical trials aren't experiments on human beings. They're scientists taking the best resources that they have and trying those against treatments that are there but aren't as effective as we would like treatments to be. And so, if we can dispel any notion that, clinical trials are experiments on humans, and that if you join a clinical trial, you are a guinea pig, as they say. That's not the case. Before phase 3 clinical trials happen, the scientists have already looked at toxicities, and they've looked at a ratio of success, and then try to apply it to a larger population.
So I'm just wondering, what have your roles been? You've been around with the partnership since its inception, and you're the current chair now. Have you always been in sort of that leadership role with the partnership? And if so, what else did you help lead besides those 2 work groups, or, any notable work that you've helped the partnership get out in the past?
So in the past, I was a little bit reluctant to step forward to this level, but I was highly engaged in the summit because I saw the value of it as I spoke. The survivorship work group, because I thought there's so much to do and so much that people need to know when they're faced with a diagnosis, and so much a change in an attitude that, I am a survivor and we like to say you're a survivor from the moment of your diagnosis. And most people don't like to say that. They say, oh, you know, in 5 years, I can call myself a survivor. I said, no, you have to just imagine, just know that every day that you're fighting this, you're surviving it, and you are a survivor. As I said earlier, also, I'm involved in the palliative care work group, and as a part of that, there is an advisory council for the director of the Department of Health, and because I was doing palliative care work for the partnership, I was invited to sit on that advisory council for the director of the Department of Health to talk about palliative care and quality of life. And let me just segue for a second to say that, you know, palliative care is really an extra layer of care that is available for people with maybe a life-limiting or serious disease to help them to deal better with it, given more resources, a physician to treat pain, maybe anxiety, maybe depression, a nurse to manage the medical system, a social worker to deal with all of the sundry social issues that come up, finances, family, helping people communicate better, and a chaplain to deal with the spiritual, help people deal with their spiritual resources. So those have been at least the Summit, the Survivorship, and Palliative Care, 3 of the groups that I've worked on.
And so, speaking of those groups, you know, the partnership is attempting to strengthen our membership at this moment, and, you know, particularly during this difficult time when cancer survivors really need support more than ever. So the partnership is transitioning into getting our work groups started again, and you are going to be involved in that process, of course. So you are going to be a part of the survivorship work group again, and potentially the palliative care work group. So can you speak of what you would like to do with those groups now and moving into the future, and how that may differ from what you have done in the past?
Well, I think if I start with the palliative care work group, my goal in that would be to get the message out there that palliative care is for people facing cancer. And given all of those resources, it would be foolish not to avail yourself to get the help that can make it so much easier, make it easier to cope with your diagnosis, easier to cope with treatment, easier to cope with side effects. You know, and so many of the good physicians who deal with cancer do a lot of that, but when you have a primary team simply focused on all of the extras, you can imagine how much more they're able to give to the patient and their family members. I would like to see survivorship begin to look at some of the political ramifications around cancer, from, you know, advocating for more funding from the state, more funding from the federal government to help people cope with their illnesses, to look at medications and how they're, you know, how they can be prescribed and how they can be afforded, because that's certainly going to deal with how people are treated. And a couple of things. I'd like the Summit to continue to be on the cutting edge of what's going on in cancer care. And I think for the last 12 or 13 years, each year the Summit is presented. There's something new nationally and something that Rhode Island is doing that's on the cutting edge of cancer care. So a couple of things. More importantly, I'd like to see more people get involved. It's relatively easy to contribute. You know, it's been said, you know, 95% of it is showing up. If people want to show up, they can contribute to all of the work groups, and all of the work groups have a place to advance cancer care, help survivors, help them deal with things. So if you have an interest in any of the groups, I'm more familiar with the ones I mentioned, but it's looking at policy, we're looking at environment, we're looking at prevention. So you think of the prevention work group, just getting sunscreen out to the Pawtucket Red Sox ball games 2 years ago, so the people in the stands didn't get sunburned, making people aware at the beaches where we do a screening for people. We've discovered melanomas, and we've actually saved people's lives by being on the beach and bringing dermatologists down and having people who volunteer themselves come in or want to be checked and get a chance to be checked. You don't have to worry about paying for a dermatologist visit, but they can be checked. And we've discovered several cases of melanoma, and we've discovered other skin cancers, basal and squamous, and been able to get those people the treatment they needed before there was something that would have, could have been life-threatening.
Great, thank you. You mentioned kind of becoming involved and kind of fostering that. So we actually do have a few board positions that we are looking to fill. So just, thinking about that, what types of individuals or skills do you think, we should be looking for, or would you be looking for the partnership?
Well, we recently added people who have some skills in finance, which has been important. But a board member is somebody who can make a commitment to the board meetings, who can bring ideas about what they'd like to see, where they'd like to see the state go forward as it deals with cancer, and who are willing to work and sit on a work group so that they can contribute and bring information back from the work group to the board. And as you mentioned, Megan, there is a board of the Partnership to Reduce Cancer in Rhode Island, kind of steers it so that it stays and is able to do things that the federal government would like the states to do regarding cancer.
Tim, I'd like to just right here acknowledge your really involvement with the partnership and how strong your leadership has been over the last year, which has helped us, I think, to really pick up some momentum in the key areas of the work groups and board development. And our organization is moving forward. And as I've often said, you need that leadership at the top to kind of rally the troops, if you will. And you've done a fine job of that. And I'd be remiss if I didn't acknowledge and thank you for not only the years of service that I wasn't involved, but since my participation a year and a half ago. It's been great to work under your governance and leadership on the board. So thank you.
Yes.
It's been made relatively easy for me by staff, and so you, Megan and Joe, by the board, by people who are willing to sit on work groups. The summit committee, even though the summit needed to be postponed because of COVID, is working very hard to make sure that a summit happens this fall. How that's going to be, we don't know yet. We have contingency plans, and however it needs to happen, we can be assured it's going to happen. So between the board, the executive committee of the board, and the work groups, it's delightful to be able to say, well, we're making a difference in Rhode Island regarding cancer. That in the 12 years that the partnership, longer than that, has existed, so many things have changed, and yet the need to advocate for patients, for family members, for the community regarding cancer continues to be there.
Thank you, Jim.
Thank you, Jim. Thank you for taking the time.
You're welcome. And if you're watching this, consider joining the partnership because, you know, whether you know it or not, you can make a difference. It's a matter of being interested and willing. So, you know, your willingness is the most important aspect for you to become an active member of the partnership, however you're able to do that.
Well
Absolutely.
said, Jim. Thank you.